Thank you for joining us again for another episode of Matters of the Heart, a program brought to you by Haverhill Community Television as well as Pentucket Medical Cardiology. My name's Dr. Srivastava, a cardiologist here in Haverhill, Massachusetts, and I'm here today with one of my colleagues, Dr. Seth Bilazarian, an interventional cardiologist also here in Haverhill, Massachusetts. And today we're actually talking about something that maybe is a little bit tangential to cardiology, but actually, truthfully, it's a major issue for so many of our patients who come in, and we're actually going to end up talking about sleep and the ramifications of a poor night's sleep, what it does to you from a health standpoint, and then I think we will probably review some strategies to achieve good sleep. Is that an accurate statement?
Yeah, I think that's what we're going to do.
So with that, I will hand it over to Dr. Bilazarian and see how he wants to start this off.
Yeah, well, as you said, I think that very accurately that we've covered a topic called sleep apnea, which is an extreme type of sleep disorder. But many patients have difficulty with sleeping. It's an important issue, as you said. It's a critical health issue. It's not something that either of us would consider ourselves experts on, but there's a lot of data out there, and I think that we recognize it, and I thought it would be important for us to spend a little time talking to our audience about sleep in general and these issues. So briefly, just what is sleep, I guess I'll just mention. And it used to be thought that sleep was just a time where you weren't doing something else. But in the last several years, sleep research has really done a lot to understand that there's really critical things that sleep does other than just resting. And that is that we form our memories during that time. It's a really critical thing for learning. And that those aspects of sleep that are critical happen during phases of sleep. So there's different cycles of sleep. People have, I think most of our audience has probably heard of the term of REM sleep, which REM, R-E-M, stands for rapid eye movement, because with your eyes closed, your eyes are moving very rapidly. It's often when we dream. So there's different stages of sleep, and there's a lot of vital things that happen during REM, so during sleep in general. And I want to talk a little bit about sleep and why it's so important and what are the issues and what not.
So I get this question a million times from wife, kids, friends, patients. So how much sleep should I get at night?
Well, it's a really good question, and I won't address the non-adult question,
yes,
but younger kids and teens often do need more. But it does vary from person to person, and you and I have known people in our career. It seems like the chiefs of medicine often only need 3 hours of sleep. I don't know what that is about them and that, but most people need about 7 or 8 hours of sleep. There's no real evidence that shows that older patients or people can get by with less sleep than younger people. But as people age, they often do get less sleep, and it could be that they also spend less time in those deep restorative sleep that, like the REM sleep that I described. But one of the sort of most practical, simple things is that, and I know this from my own self as I get older, is that as you get older, you are much more sensitive to be awakened by even slight disturbances. Mm-hmm. You and I both went to college, and college dormitories are incredibly loud, and I never had a problem sleeping in college. But the littlest noises now disturb me, and I wake up. And I think as people get older, that can be a big impediment to sleep.
Right. I know my 7-year-old son can sleep through anything.
Right.
He'd be in his room, banging around there, nothing. So he'll sleep right through it all.
Right.
So
does it really matter if you get this amount? Whatever this amount is, 7 to 8 was probably be an average. And of course, like everything in biology, we know there's a range. Some people 6, some people are going to need 9, but on average. But it absolutely is really critical. If you don't get enough sleep, it really has health implications. People whose sleep is frequently interrupted or cut short might not get enough of the certain stages of sleep that I described. And how well rested you are often will have a lot to do with how well you function the next day. That's really a critical thing that I want to just spend a few minutes talking about here as we go forward. So one of the things that I thought was interesting, if we just break down 3 aspects of what happens if you have inadequate sleep, and those would be performance, mood, and health. And we'll just briefly talk about that. I mentioned that the REM sleep is when we learn or sleep, that if you don't get adequate sleep, then you're going to have more difficulty thinking clearly, reacting is going to be more difficult, and you're going to have more difficulty forming memories and learning. So, learning, people hear learning, they think, that's just for students. No, we're all learning in our job, new tasks and whatnot. So that's a really critical thing. If you don't get enough sleep, you're going to have struggle in those areas. Research also suggests that sleep is needed for creative problem solving. And one of the things I thought was interesting that I found is that people who don't get enough sleep often make bad decisions. So something as simple as just, living your life. There are people who don't get enough sleep will take more risks and just don't think clearly. And of course, all kinds of other things, like for younger people, performance in school, but also have a greater risk for simple as crashing a car. I crashed a car when I was young as an intern, up all night, driving home, and crashed a car. Fortunately, wasn't hurt. It didn't hurt anybody else, but it's a real issue, and I think that we have to know that's an important thing. I think there's a lot of public awareness about drunk driving, but sleepy driving is certainly important.
Well, it's interesting you bring up the poor decision things. I do notice or wonder about when fatigued, making poor choices with food, for example, always going toward, and maybe there's a lot more to it, but always going towards junk food. It's easy,
Yes.
pizza or something else as opposed to eating a healthy, nutritious meal.
That choice is a different thing, I think.
Yeah.
I was thinking more, for the purpose I was talking about, just even choices about decision making and personal life, financial decisions about work, those kinds of things. So the second thing we'll talk about is mood. Insufficient sleep can make you irritable. I think everybody knows that. Parents of children know that their children are irritable when they don't sleep, but it's certainly an adult phenomenon as well. It's linked to poor behavior and trouble with relationships. People don't sleep well, they're irritable, and of course, they don't get along with the people they have relationships with. And those who lack sleep are more likely to become depressed. So those are mood issues. So I mentioned so far performance and mood. And then the third thing is a health issue. People who have sleep issues, we've talked in the past about an extreme form of sleep problems like sleep apnea, and we know that sleep apnea is linked to blood pressure issues, diabetes, weight gain, but even lesser forms of sleep problems, not sleep apnea, frankly, are associated with those problems. And the thing that you just mentioned is that the poor decision is really that when you are sleep deprived, you don't have the hormone release that suppresses a desire for carbohydrates, so bread and sweets. And just as you said, I would say the exact same thing. When I'm up all night taking care of a patient, the nurses' stations often have donuts. I'm never tempted by them except the night I'm up all night. And it's really a remarkable thing, and that's a hormone thing. Yeah. So, it's almost contrary, like sleep more, but be able to diet better, and that's really what's being said here by this data.
I had the same thing when I was a resident, and I'd be up all night every third night. The next morning, there was a Dunkin' Donuts in the lobby. I would always feel justified to go get a donut.
Right, and, it may be part of that. It may be part of sort of a reward for being up all night. Yes. So if you do have sleep difficulties, you're not alone. 70% of adults say that they have some problem with sleep, either insufficient sleep or just can't sleep once a month. So 7 out of 10 people, you're meeting someone on the street and, there's a 70% chance that they might have had difficulty sleeping last night. 11% of people, that's a lot. That's 1 in 9 people have difficulty every single night.
Wow.
So it's a big, big problem. 40 million Americans, so we have 300 million people in the U.S., so whatever that is, 4/30ths, so whatever that is, 2/15ths. So around 15% of people have a really serious sleep disorder like insomnia, restless leg syndrome, sleep apnea, or narcolepsy. But we're not talking about those people. We're just talking about the people who don't have those more serious sleep disorders. Like eating well and being physically active, which is something we've talked about, but you've been a real champion on our programs about lifestyle changes that are geared to doing the right thing to take good care of yourself and taking ownership for lifestyle changes, eating right, eating not too much, and exercising. Sleep is really an important part of that. And the solution is not just take a pill. It's sort of some things we're going to talk about here. So we're going to go through some 10 tips for better sleep.
So let's get started.
But I first wanted to talk about a concept called sleep hygiene, which is just sort of a simple concept. And everybody knows the term hygiene, I think. One of the things, you have good hygiene, you wash your hands because there's germs and you don't want to be sick. But the definition of hygiene is conditions or practices which help maintain health and prevent disease. So good standards for good health. So sleep hygiene, the definition for that is anything that's behavioral or environmental that you do before sleep that helps promote sleep or that you don't do that interferes with sleep. So that's what's called sleep hygiene. It's a term that's out there and people talk about. I talk about the term with my patients sometimes. So the practice of sleep hygiene is just following some good ideas that help you get more restful, effective sleep. Not just more sleep, but effective sleep, deep sleep that really helps restore you. And doing that, of course, will help promote alertness during the day and helps people just avoid these sleep disorders which are problematic. Trouble sleeping and daytime sleepiness can be real indications of poor sleep hygiene. And the importance of assessing these things is really an important thing that we really shouldn't, avoid, and we really need to take ownership. When our patients complain about it, I try to spend time. I admit I don't do as good a job as I should, but preparing for this has helped me think more about really being thoughtful about talking to patients. And I've always talked about a few of these tips I'm going to talk about, but I'm going to talk about 10 of them shortly. The sleep disruptive effects of poor sleep hygiene, I thought this was a fantastic thing that is something to think about for everyone in our audience, is that when people have poor sleep and they're irritable or have other kinds of effects on their job and whatnot, it's often obvious to people around them, but the person themselves may not recognize the linkage. So it's really an interesting thing that maybe we can help point out to patients when they complain about, being irritable or having difficulty sleep, trying to make that linkage as something that could be really helpful for their overall health.
All right.
So let's launch into 10 sleep habits, and these are, again, some things that we talked about, 10 tips for better sleep. And
it's like a Letterman top 10?
Yeah, I don't know. No, I think they're all 10 are important. So one of the things is to stick to a sleep schedule, and I know this is something that I struggle with, busy as a cardiologist, wake up early and often go to bed late during the week and then try to catch up on the weekend, but that's not good. Try to go to bed and wake up at the same time each day, even on the weekends. We're creatures of habit, and when we have a hard time adjusting to altered sleep patterns. While it's tempting to sleep late on weekends, it won't fully make up for your lack of sleep during the week. So you can't say, well, I'm going to sleep 4 hours a night all week and then 14 hours on Saturday morning. That just really won't be a healthy way to help. And the other thing is it makes it very difficult to wake up on a Monday morning if you slept till 11 o'clock on Saturday and Sunday. So keeping sort of a regular sleep habit, sleep schedule can be really valuable. That's tip number one. Weigh in on any of these if you have any thoughts.
No, I mean, I think I actually find that on the weekends when I want to sleep in, I wake up because I do it every day of the week, and I'm up, and so be it. So it's so maybe I guess that's a good thing. Okay.
Tip number 2 is a personal favorite of yours, I know, and that's to exercise. But exercise is, of course, healthy. We've emphasized this, and obviously has weight benefits. It has all kinds of benefits. People who exercise are more alert. All kinds of good things happen. Better mood. So exercise is good. But in terms of the sleep rub, just sort of a common sense. If you exercise, you might be more fatigued at bed to recover from the exercise. And that would be better for helping to sleep better, to give you a more deep and lasting sleep. But one recommendation is to not exercise too late. Some people don't like to get up in the morning exercise, so they'll exercise at night. But if you exercise close to bedtime, your heart rate will be up, and it'll be much more difficult to sleep. Your body temperature will be up. So those things will make it more difficult to fall asleep.
And what is it about, I know that a heightened body temperature reduces your ability to fall asleep, but why is that? Is it something?
I don't know the answer to that question, Matt.
Because I've heard that numerous times, but I've never really thought it through as to what it is going on in the brain that won't let you.
I don't know whether it's just the relation of the feeling of the heart rate, and that when we sleep, I think we all know that our heart rate does fall, and whether that
temperature goes down.
It doesn't mimic sleep, so maybe the body's not ready for it. I don't know. Yeah. But a second thing that was, I thought, very interesting, and these could certainly go together. There's almost 2 tips, but I made them one, and that is if we get out in the sun, out in some fresh air, or as our moms might have said, that getting sun exposure helps our body keep the biologic clock of the day, so-called circadian rhythm, right. So if you get out during daylight and exercise, you're also getting the sunlight that tells your body this is day, and then when it's night, your body can be more geared to nighttime use. So exercise potentially during daylight hours can be of value, but if you can't exercise during the day, at least get out for a noontime walk to get some sun. Yeah. A third tip I think people know, but just to emphasize again, is to skip caffeine. Caffeine is a stimulant. And people who enjoy coffee, like myself, enjoy it in the morning because it is a stimulant. It sort of wakes you up, and we don't want to be woken up when we go to sleep. Again, something that has happened to me as I age is I remember I could have coffee at 10 o'clock at night when I was young and go to sleep without problems, but now I've had to actually keep pushing it back. If I have coffee now, even after noon, it's not terrible, but it will have an effect on my ability to get to sleep very early. So people say some of the recommendations is to wait for a full 8 hours before bedtime. So, that's close to what I just said. If you go to bed around 10, around 2 o'clock in the afternoon, go to bed around 11, 3 o'clock in the afternoon would be 8 hours earlier to avoid caffeine. And there's sources of other caffeine are colas, Coca-Cola, Pepsi-Cola, those kinds of things. Certainly teas. Tea actually has more caffeine than coffee. And some kind of chocolate. Those are all things that have caffeine, so it'd be important to avoid. Another stimulant, which, of course, we emphasize strongly that people avoid, is nicotine in the form of any source of nicotine, but nicotine from cigarettes or from chewing tobacco would be also stimulants that you should avoid before going to bed.
Very good.
Okay.
So what's that? Is that 3 or 4? That's 4.
I don't know. We've lost track.
We'll see.
So we'll
Okay,
keep moving on.
What's next?
So the next one is to avoid alcoholic drinks before bedtime. Now, one of the things that I think people will notice is that you have something to drink, you have a beer or a glass of wine, you get a little sleepy. So people, I think, are interested in that. There's the term the nightcap. You have a little drink, you get a little sleepy. And it can be effective in helping people fall asleep. I know if I have a glass of wine with dinner, I'm a little sleepier at night. But the problem is that you may fall asleep more quickly, but it won't give you the deep sleep that you benefit by. And you may actually have that wear off and you wake up a few hours later. And I've had that experience as well personally, that I might fall asleep more easily, but I don't get as good a sleep when I take alcohol, a glass of wine or something like that. So I think that would be something to really be cautious about. If you notice that you're not getting restful sleep, or that if you're waking up early, that avoiding that alcohol could be something that might be valuable.
Very good.
Next one is, of course, something we recommend is not to eat too much, but eating too much before bedtime. A large meal can be very problematic, or beverages at night. Both of those can be a problem, because if you eat heavily at night and then go to sleep, your body's digesting. A variety of things can happen. One thing that we talk about is reflux. Food can come back up, and that can wake you up just because you're laying down now, and the acid contents of our stomach can come back up into the esophagus. That can certainly be a problem. Certainly if you drink a lot of fluids, you're going to wake up to urinate. That's not going to promote good sleep. So these are all, seem simple, but strategies that I think if people adopt some of them might benefit their sleep a little bit. These are all so-called sleep hygiene strategies.
Absolutely. I had a point that I was about to ask, and it just slipped my mind, so
Okay.
I'm going to have to interrupt you later
No
if
problem.
I think of it.
No
But
problem.
go ahead.
So the next thing would be to avoid medicines that delay or disrupt sleep. So one of the things that I noticed, my family members asked me these questions, is, what medicines can you take for even like over-the-counter things, like cough or cold remedies? And one thing that's a little bit of a trick, the way it's sold, is you'll see certain kinds of remedies are listed as non-sedating. It'll say this cough medicine is non-sedating. Well, it's really a trick, because if it's non-sedating, it means it's actually a stimulant. And there are certain medicines like decongestants that are known to stimulate and make it very difficult to fall asleep. So medicines like decongestants like Sudafed, or the generic form is pseudoephedrine, those medicines are stimulants, and they will in fact dry out your sinuses and are pretty good for helping people with cold symptoms, but they are stimulants and will make it much more difficult to sleep. So I'd be cautious about those, particularly if you have a cold, or take those regularly. There are some medicines that people take for allergies, and these allergy medicines are sometimes come as a combination pill. For instance, a medicine Claritin. Now that's a medicine that's an antihistamine. That does not cause any people problems with sleeping, but it can come with a decongestant, and it will be listed as Claritin D or Allegra D. And the D is the decongestant I was just mentioning, and that will often keep people awake because it's a stimulant. So those are some things to think about avoiding medicines that can stimulate people and cause it more difficult to sleep.
Very good.
So moving on then to our next one would be to not nap. And I have patients who struggle with this. They don't sleep well at night. They're exhausted, and then they sleep during the afternoon. And I understand that you're exhausted, but what happens is people can actually get into a bad situation where they end up sleeping for 2 or 3 hours in the afternoon, and then it just feeds a sort of vicious cycle where they sleep in the afternoon, and now, of course, they're not tired at night. Then they don't sleep at night, and they sleep more and more in the day. And the recommendation is to try to limit that to not more than an hour. I would say even shorter than that if you take a 30-minute cat nap.
Or just none at all.
None at all, but if you really do need to it. But I've had patients who have been in this situation, and I said, we've had success with just taking the strategy of every day for a week, don't take a nap. Just force yourself. Just go for a walk, do something, and then try to get back into the cycle of sleeping at night. So a a nap during the afternoon can be something that's not terrible, but really have to limit it in terms of what's the best strategy. An anecdote I remember, former United States Senator William Proxmire used to sit in his chair in the afternoon with a spoon and a tin cup on the floor, And he said when he would fall asleep, the flight of the spoon from his hand down to the tin cup on the floor was enough rest for him. So that was, the shortest nap that I've ever heard of. But I thought that was an interesting sleep strategy.
Quite a strategy.
So, so how about the sleep environment? So again, a common sense, but many of my patients, I see this in the hospital, are sleeping with a TV on.
I was going to ask you about that. Okay.
So it's a very simple, a good sleeping environment. Make the room dark, shut the shades, turn off all the noise in the room, and try not to make the room too warm. Warm rooms are more difficult. So when you first go to sleep, it might feel a little bit cool in the room, but you get under the covers and it's not that cool. So try to keep it on the cooler side, preferably closer to 60 than to 70, maybe 61 or 62, but intentionally try to keep it on the cooler side. That will help keep your body cooler and more likely to have a good restful night's sleep.
Now, what about people who read in bed before they go to sleep or watch TV for 30 minutes before they go to sleep? Is that, to me, I've come across in my readings over the years that that's considered poor sleep hygiene, that the bed should be for sleeping. Don't do any of those other things. Or what's your thought on that?
Well, you said two different things. I would say the TV is certainly something that I would agree, because TV can be very stimulating. I mean, depends what you're watching, of course. Yeah. Watching an exciting movie or a sports program, it might be very difficult to fall asleep after that. So I think the TV certainly would be more problematic. And certainly if you have a TV that's left on and you fall asleep, then you have to get up to turn it off. Or even if you just have a remote to turn it off, you're sort of disrupting that sedating effect of the early sleep. But I've not heard, and I personally don't think that I've had any negative experience from reading and falling asleep. So I think that would be, I don't know why that would be.
I've read as a solution for somebody who's having has poor sleep hygiene, difficult times falling asleep, to just make it the ideal, most optimal sleep hygiene environment, sleep environment, and is getting rid of all that other stuff. But often I know people who puts them to sleep, basically.
I would definitely be in that category.
Yeah.
So another tip is to as you said, to make the room sort of a haven for good sleep, and that's to relax before bed. I mean, obviously, if we are working hard, either physically with exercise, or we're in some kind of mental issue, where we're, having a vigorous conversation, or doing business dealings, or doing work at home, or having an argument with family members, it's unlikely to be successful to really get to the sedating results of a good night's rest. And something that I put with a sort of second tip, this is another 2-in-1, is if you are having sleep, taking a warm bath or a hot shower can help cool your body, because when you come out, your body will be more cool. We dilate our blood vessels, and we can actually cool, and that can be another way to become sort of very relaxed before bedtime. So the last thing I would say is the 10th tip is to see your doctor if you are continuing to have trouble. And there's a variety of issues we've talked about in our own practice. We have a sleep specialist that can be helpful to help people with sleep hygiene or the extreme forms of sleep disorder like sleep apnea. So I would say that those are definitely strategies that should be taken on, and talk to your own doctor about medications and other kinds of strategies that can be taken on. So I would say that those are the highlights that I would say are the 10 tips for good sleep hygiene. One other tip, this doesn't count as the 10, that I thought was an interesting thing, as a sort of a bonus. Yeah, this is your 11th tip. Is something that I hadn't heard before that I would just pass on. This is from the National Institutes of Health. They have a handbook for recommendations for good sleep. And they said that if you are somebody who does struggle and you're just laying there and counting ceiling tiles, or just, can't sleep wide awake, is to actually get up. That's just to not lay there for more than 20 minutes, to get up and try to do something else that helps relax you, and then try to return to bed, rather than just, because you can actually get into this funk of, I'm not sleeping, I'm not sleeping, I'm not sleeping. To actually get up and try to do something that's relaxing, and then maybe return and try again in a little bit. So I thought that was an interesting strategy. The final few minutes that I have, I'll just mention that there are medicines, and you and I talk about medicines. We've done prior programs on medicines for people who are overweight. We never recommend medicines as a first strategy. We always think that lifestyle strategies, the ones that I've emphasized, are first steps. But we will talk about some medications that are available, and we can prescribe these medicines. These medicines are available, but two I will mention that people use with some varying effects that are over-the-counter are melatonin and L-tryptophan. These are over-the-counter homeopathic or vitamin-based supplements that people can have some success. There's some medical substance to why these might work. Melatonin is something that goes up and down with our circadian rhythm, so by taking it, you might emulate or simulate what our body's doing. And L-tryptophan is a amino acid that's available in Turkey, and everyone has the experience after Thanksgiving meal of sleeping. So that's the idea behind that. So people have variable benefits from those over-the-counter strategies, but there are a variety of prescription drugs that are available, and they have some issues. A 2008 Consumer Reports evaluation of this did a very nice job. It's available on the web. And Consumer Reports 2008 sleep medications were reviewed, the couple, and the most commonly used one in their sort of best buy was this drug Ambien. And Ambien does help people fall asleep in about 30 to 40 minutes. And the nice thing about it is they don't wake up drowsy the next morning. Only about 2 or 3% wake up drowsy the next morning.
Yeah, I was going to say, anecdotally, I feel like that's not I feel a lot of people wake up feeling drunk the next day.
With all the medicines or Ambien per se?
With Ambien specifically.
Okay.
But,
they made the point that the longer-acting Ambien does that more, and that sort of makes common sense to us that, you know, if it stays in your bloodstream longer, and 15% of people wake up drowsy with the long-acting Ambien, whereas only 2 to 3% with the shorter-acting Ambien. And it definitely has issues. It can make people dependent on them, but it definitely does help with sleep. So some people say, I can't sleep without it. And again, if that's the case and you've really made an effort with these other 10 tips, then perhaps that's a strategy that can be helpful. There are some other strategies. There are medicines in the Valium family, benzodiazepines and whatnot, that can be used, but those obviously have more addictive potential.
What about Benadryl? People sometimes use Benadryl.
Benadryl is another over-the-counter drug that's very inexpensive that can be effective. So I guess I would just say my final recommendation would be that if you have chronic insomnia, something that happens more than 3 times per week, and you are struggling, you know, certainly try these tips that we've mentioned, these sort of simple tips. If they persist, talk to your doctor. There are some over-the-counter remedies that can be effective, and there also may be some prescription remedies. But sleep is important, and it can have huge effects on performance and on your health and your mood. And we don't want to underestimate it, and hopefully some of these will be helpful for our audience.
I think it will, so thank you. It's helpful for me as well, making me look forward to a good night's sleep tonight. But that was a great review of some very easy-to-implement strategies for better sleep, and so thank you for doing that. And with that, I want to thank the audience for joining us for yet another episode of Matters of the Heart. This was brought to you by Pentucket Medical Cardiology as well as Haverhill Community Television. Thank you and have a good night.